So we're going to go over some self-grassening. Graston, if you have not had it before, is a metal bar that's been formed to take different shapes depending on what areas of the body you want to work. It is great for breaking down adhesions, it's great for realigning fascia, creating blood flow, and it does save the hands of the practitioner who's treating you. It's great for getting to specific areas like tendons and ligaments. So doing it at home, I actually just use a spoon. I hold the handle of this, or I hold the spoon, and then I use the handle to actually do the grassening. And so I kind of angle the spoon. I don't know if you can see it there. I'm just going to change the angle. So we kind of come in on a bit of an angle. I'm going to go over how to do the quad tendon and the patellar tendon. So this is for anybody experiencing knee pain, you know, kind of pressure inside the joint might be a description or a symptom. It hurts with extension, flexion, maybe squatting, bending down. It is important to roll the bulk of the muscle, but you also want to get the tendon. So with my spoon angled, I'm going to come in. The quad tendon is right around here, about the first inch or two right above the kneecap. And so coming in angled, I've applied some lotion. I use coconut oil, and I just start kind of scraping. You'll feel when you hit the bone. That's okay. You don't need to apply a lot of pressure, just to get a sense of where you are on your leg. Get right up to the bone, and then you know, okay, I don't need to go that far. You can back off, and you just rub back and forth. For you cyclists, getting into the VMO, this meaty muscle on the side of the knee with the graston, or your graston, your spoon, will be really good. And you just kind of scrape. You typically go until you get some redness, maybe a bit of purple. You're not applying a lot of pressure. You don't need to apply a lot of pressure, especially when you're in an area where there isn't a lot of meat. You can also, something I like to do, I'm going to back it up here, is add some extension while I'm grassening. So, adding some movement in there. Just something else you can try. Then we'll go over the patellar tendon. So your patellar tendon is the front tendon right at the bottom of your kneecap. This graston technique is also really good for anybody with knee pain again. This patellar tendon is going to start to get tight and pull when the quad tendon gets tight, because the quad tendon is going to pull on the kneecap's going to pull on the patellar tendon. So again, my spoon is angled and just going up and down. You don't need to apply a lot of pressure for this one, especially because there's not a lot of meat underneath there. You can flex and extend as you do it as well. You want to spend about 30 seconds to a minute grassening each spot. Okay, so we're going to go over grassening for the tib anterior, this front part of your shin, meaty part. You can do some flexion, plantar and dorsiflexion of the foot. If you're feeling any types of shin splints, a lot of us are, being pretty active while we're home right now. So if we might be overdoing it, you might be feeling it in the front part of your leg. You can also get right into the tendinous part of that tib anterior. If you dorsiflex your toes, your foot, you will see a tendon pop up, and you just ever so slightly grasp in the top of that. Again, not a lot of pressure, especially when there's no meat underneath there. You can also get your Achilles. It's a great tool for that, pretty easy to do on your own. Again, you can do some flexion, getting right into that area right along the side, into that meaty area up here. So you can kind of play around with it. You can also get the base of your foot. The handle is angled. Anybody feeling some plantar fascia kind of pain? Another good one is just rolling on a golf ball, putting golf ball on the floor and just kind of rolling back and forth. But grassen's pretty good. You can get pretty specific into some of the insertion and origin points there. Grasping the IT band, you're going to have your handle of the spoon angled, and the IT band comes into here, right up against the bone. So just going back and forth there until there's a bit of redness. Then you can actually add some movement in it if you want as well. So if you're experiencing any kind of outside knee pain, this can be a really good one to do, as well as rolling your quads and getting in some of those clamshell exercises. Okay, so we're gonna go over some self-massage for the quad, the hamstring, and the IT band. So we're gonna start with the hamstring. I have applied coconut oil over the entire leg. My leg is bent, and I'm just kind of moving my hands, using my hands kind of in a cupping motion, and I'm leaning back. So trying to get some weight through those hands, coming up through the hamstring. And then you can also come down, and then I start straightening the leg, doing a bit of active release. Lean back, use your fingers, and pull up. This is still not as effective as rolling with the lacrosse ball. So if you haven't checked out that video, definitely do so. This feels okay, but I still find the lacrosse ball much more effective. Now for the IT band runs from the knee up to the front side of the hip, and it runs in between the hamstring and the quadricep. So trying to get in between those two areas and break up tension is what you're trying to do when treating the IT band. We don't actually ever really try to strip out the IT band. Well, you do, but it's more important to try and break up in between the IT band and the hamstring and the IT band and the quad, because that's where things get stuck and that's where the restrictions happen. So using my fingers, you can feel there's a pretty thick band right there, and then I go over a little ledge, or and then you're into the hamstring. And so using my fingers, I basically kind of lean back and I run my hands up along that edge of the IT band. Now to get some active release in here, I start with my leg straight, and then my leg goes, bent, and then it goes straight. So leg is bent, straight. And as that's happening, I'm leaning back and I'm using the pressure through my fingertips to get in between those two structures. All the way up. Good. And then for the quadricep, so the quadricep is definitely harder to feel that ledge. So what I actually find more effective is trying to treat the fascia. The fascia is a connective tissue. It runs under the entire length of our skin, and it can get malaligned, it can get restricted and cause pain and range of motion issues. So something I call skin rolling, basically picking up the tissue and letting it roll between your fingers. You can work all the way from the quadricep all the way to the back side of that hamstring as far as you can reach, I suppose. And you can go in all different directions using your fingers. You can kind of do that. And then coming up to the top part of the quad, doing the same thing, letting the tissue roll between, roll down. You can do this for, I don't know, anywhere from a minute to 2 or 3 minutes, depends how long your fingers can handle it. It does feel really good. You might feel some areas that are more restricted than others. By that I would mean you might feel some little bumps underneath your fingers, or you treating the shin, or this tib anterior part, is great for anybody dealing with some shin splints right now. So my feet is flat on the floor, thumbs are up at the top, and I'm simply just pushing down right onto that meaty side, outside front part of your lower leg. You'll feel where you hit the bone versus the muscle. You can also add some flexion and extension of the foot, and then pushing down. So when my toes are up, Thumbs are up, and then as my toes go down, my thumbs go down with a downward pressure. Now you're doing your own active release. Massaging the calf. So foot is flat on the floor. I'm just using my fingertips and pulling up. Fingertips like this, pulling up and leaning back as I come up. So I have some extra weight of my body going back. Digging in with your fingertips. Then you're gonna do some active release. So we are gonna go over how to do some fascial work on your lower back. After a day of sitting, our low backs, everything gets really compressed, everything gets really restricted, and the fascia is part of that as well. And so we want to create some blood flow. We want to try and realign all the fascia and get some movement, some flexibility in there. So to do that, I'm just going to show you here. So you're going to feel the top of your hip bones right there. You're going to take your 2 fingers, place them onto your back with your thumbs on the top. You're going to pull down and roll that skin. It's superficial, which is why it gets the fascia. You might feel some little bumps, some little restrictions. You can go onto one side depending on how much flexibility you have in your shoulders. And then you can actually add some movement in there too, so adding some forward flexion. As the thumbs are pulling down, pulling that skin, and flexing forward. Okay, rolling the quad. So we start at the bottom of the quadricep, right above the knee joint. We're kind of on that outside part of the quadricep, going nice and slow all the way up to the top part of the hip, working through any spots that you might feel. You can hang out on them. You can do some flexion and extension. You can roll anywhere from 2 to 3 minutes. We're gonna roll the hamstring. I'm sitting on a kitchen chair and I have my lacrosse ball. Sticking the lacrosse ball underneath the hamstring, rolling back and forth. You can get it right up into that tendinous part and just sit, rock back and forth. You'll feel the ball go over top, back and forth over that tendon. You can sit there, you can do some extension, flexion of the leg, you can do some rotation. You can do the entire length of the muscle this way. Find a spot, chill out, flex and extend. This can also be another really good way to get in between that hamstring and that IT band. Kind of sitting on your side. Figure 4 stretch with the ball under there really exposes the glute muscles. So this is a great position to put your leg into, and you'll feel it with that ball a lot more. Rolling with the lacrosse ball in the glutes, back and forth. You can kind of see it under there. Moving over to the side. All over. Sitting on a spot right on that piriformis, you'll feel it. And then opening and closing the legs. getting into that glute med on the side. Again, opening and closing the legs, getting your own active release. Rolling the glutes with the foam roller. I like to have it lengthwise so I can go back and forth. I find that really good to hit that piriformis. You can sit on a spot and go back and forth, or you can turn it this way, go up and down. You can sit on a spot and do some leg drops. So rolling your QLs, which is a major muscle of your low back, you want to find the sides of your hips. You're gonna work your way in, and then you'll feel a nice band, a nice ledge right there. And that is your QL. So that's where you want to try and roll with the foam roller and with the cross ball, which I will show you. So I'm on my foam roller into that area of the QL that we were just pointing at, and you can feel I'm kind of on my side. My hips are actually up, so I'm getting a bit more weight. If you drop it, you might actually feel that foam roller dig into that QL a bit better. Depends on how much you can handle. And then I actually just move my upper body back and forth with this elbow that's placed on the floor, pushing back, pulling forward. And then you can actually drop your hips as well, moving the legs. Trying to release that low back. So getting into the low back or those QL muscles with the lacrosse ball, it's putting right in here, and then I'm leaning right back onto it. You can drop all the way down if you want to, and digging in. You'll feel where the ball kind of falls because you have a strong a group of muscles that run right along your spine, and the ball likely won't sit comfortably on that, so it'll just drop to the side, and that's where you kind of want to be. And then rolling, I kind of dip to the side. I know it's really hard to see, but that's kind of the motion you want to be doing if you can find that spot. So we're going to go over how to do some treatment on the psoas muscle. The psoas is a very deep muscle. It's a hip flexor. It comes from the back of your body, comes to the front to attach into the front part of your hip. So I am on my foam roller, or my rumble roller. You can use your foam roller as well. And I have the roller kind of underneath my abdomen, and this end of it is right kind of above my hip, and kind of right by my belly button. And then in this position, you kind of just sit and twist your body back and forth. So you're not moving the roller, you're actually twisting your body. So this is what I mean by we're probably just impacting the connective tissues and the things that are attached to the psoas, trying to release those things. So I'm almost using the edge of my foam roller to dig in to that area. It's a really hard one to get on your own. And don't forget to breathe. So we're gonna go over some active release for the psoas muscle. So I have my lacrosse ball and I have a weight, a 10-pound weight. You can use anything heavy, can of paint, laundry detergent, whatever you can find. I'm gonna put the lacrosse ball, I have my hip bone, and then I'm going about an inch in, and I'm putting that lacrosse ball on that spot. I'm taking the weight, I'm relaxing down. My left leg is straight as I'm treating my right psoas right now. So I'm applying some downward pressure with the hand and the weight into that ball. And as I do that, I'm going to straighten my right leg all the way down to the floor, bring it back up. So your psoas gets really tight when we are sitting. they're in a shortened position the whole time. So a lot of people complaining of low back pain, psoas is going to be your guy that you want to focus on. Good. You can move that ball around a little bit. I just moved it slightly to the outside. You know, do this 10, 15 swipes. It'll be uncomfortable, but you don't want it to be too painful. If it is, just ease up on the pressure. Some active release for the calves. I have a yoga block out here, and I have my lacrosse ball on top of the yoga block, and I am rolling back and forth to start. Really specific way to get into that calf. It's fantastic. In a good, bad way. And then I'm going to start adding in some dorsi and plantar flexion as I move, or I can just stay stagnant. Doing that up the entire length of the muscle.